Alrighty, welcome to my documentary research video. Alright, so today's topic is obviously anesthesia. So let's get started. What was it like before, you ask? So basically, surgeries were always being done. Home remedies were used to heal wounds and things and such. However, when surgeries began, surgeries were being done invasively, and around the 1840s, to be exact. So basically, these surgeries dealt with exterior and extremities while avoiding the abdomen and other body cavities in the central nervous system. The creation of anesthesia in 1846 helped create that these surgeries would no longer have patients suffering and other benefits as well. So, without anesthesia, surgeries were putting patients in excruciating pain. And something important about anesthesia is that it reduced the death rate from, forgive me for my if I'm not saying this correct, postoperative sepsis, which is a bacterial disease. Before its creation, all invasive surgery depended on a swift hand, sharp knife, and cool nerve of the operator. So they try to do things real quick and fast just to get the pain over and done with. So yeah. Some of the images I found with the required websites used in Johns Hopkins were such as this. And I found it interesting because this was used to administer anesthetics. It didn't go too much into depth of whether it was a needle or not. However, it looks like this is a roller. So I'm guessing it would in the skin how it would now. I'll get into that more later. So here we are, a perfect oil painting. As you can see, it's a group of men surrounded by someone sitting in a chair. Okay, so I will explain what is happening in depth in this image. So this oil painting was created somewhere between 1945 and 1979. And it shows William T.J. Morton, who is known as the father of anesthesia, standing in front of a skeptical group of surgeons in the operating arrhythmia theater. I guess it's where surgeries and things are done. This was done in Massachusetts General Hospital. An important date to remember is October 16th, 1846, which is when William Morton, who was a Boston dentist at the time, prepared to use anesthesia for the first time with Dr. John C. Warren, surgical patient. So it wasn't Morton's own patient, it was Warren's patient, Gilbert Abbott, and he got him to do so. This was first done by causing him to inhale a chemical ether. This would be known as the first use of anesthesia. So I just want to get in on the image. It's a very detailed oil painting. So another photo I found is similar to the one right before, as you can see. Still multiple men surrounding the patient. That is the patient inhaling the ethyl, if I'm saying that correct. And I just wanted to break down what the chemical actually was. Ether is a chemical. It is an organic compound in which two carbon atoms are linked through an oxygen atom. This is literally what the chemical would be drawn as. An ether may be a product of condensation of alcohols. Ether also refers to a loosely diethyl ether. a colorless, highly flammable liquid used in biomedical research and is historically important to the anesthetic agent. So yeah, definitely a big thing in how anesthetic was used. This was the anesthetic. So as I mentioned, Morton was a dentist, so this was used for dental science as well as other surgeries later. So during my research, I found that this is it's a face covering, almost similar to what we use today, actually. So this allowed the anesthetic drug to be inhaled by the patient and was used for dental science. So as you can see, there's the bag for breathing. You would have to breathe in. And yeah, pretty cool to see how we haven't changed too much. When did it happen? Where and why? So as mentioned, it happened in Massachusetts in the General Hospital on October 16th, 1846. And why did it happen, you may ask? Morton used a sulfuric ether to anesthetize a man who needed a surgery to remove a vascular tumor from his neck. And as I mentioned before, surgeries were extremely painful. So it did definitely help, and that this patient did not have to bite down on a bullet, grind its teeth, and just take the pain. Being as though that was such a successful story, reactions occurred. So Morton's success had led to other experiments or recreations. For example, Crawford with Crawford W. Long, a Georgia physician, had used ethyl for anesthesia in 1842, and his, helper or partner, Horace Wells, a Connecticut dentist. I'm very interested at all these dentists using anesthesia, and we both use it for medical and dental science. Tried unsuccessfully to demonstrate anesthesia with nitrous oxide instead of ethyl, just very different. In 1845, they were unsuccessful. However, this did lead to other people trying to recreate it, getting more experiments started to enhance what they could have done with anesthesia. However, the public's view of anesthesia was positive. For example, reports of painless operations continuously were reported. Painless operations were an amazing benefit, okay? Listen, these people were going through excruciating pain at the time. For example, when soldiers were getting their limbs cut off or anything in like Civil War, they would have to just go through it. And honestly, I couldn't imagine having to do the same, being in their predicament. Anesthesia today is used every day to perform safe and painless procedures. It can still be inhaled, as I mentioned, just as this is the same mask, kind of. We still use a breathing mask or tube. However, it's very different in some ways, such as it can be injected into the bloodstream through an IV. So we definitely did enhance the drug through more experiments and throughout time. Just wanted to show these are my citations. I did use the Johns Hopkins and National Library of Medicine as required. Also, I also used information based on my History of Medicine textbook, Cambridge Illustrated History of Medicine. Yes, so thank you once again for listening to this documentary.